Hi, I am Dr. Rebecca Weiss coming to you from Norterra Family Medicine. I am joined today by Janet Fales. She is an esthetician, a laser technician, and an office manager at Paradise Med Spa and Wellness. Today we are going to be talking about acne, so I thought Janet would be the perfect person to discuss the topic with.
Thank you.
Yeah, you're welcome. Thank you for joining me today. So Norterra Family Medicine sits adjacent to Paradise Med Spa and Wellness for those of you who haven't been to our office. And we kind of share some space and so we've gotten to know each other very well. I work in both locations. And so because I do a lot of skincare at both offices, I do treat a lot of patients with acne and other skin conditions. So I thought this would be a great opportunity to kind of present different options for acne treatments, both medical options as well as options you might find at a medical spa practice. Right? A lot of you may not be familiar with all of them. So first, I think I will tackle the medical side. So, acne can be very debilitating for patients. And acne is not doesn't discriminate based on age. I wish I was just telling Janet before we film this. I'm like, I got to cover up my pimple. And I'm 50 years old and still breaking out. So unfortunately, it's not one of these things where you're just going to outgrow it and you can just say, just wait it out, because it doesn't work like that for all patients. So, it may start when you hit puberty and continue on. It may start in puberty and miraculously go away when you get a little bit older, but there's no telling for sure. And there are familial characteristics where, like, if you have a parent who required Accutane for really severe acne, you may be at higher risk for having a child, that has acne, more severe acne. So, again, my heart goes out to acne sufferers. I really feel very strongly about helping these patients because I know how emotionally scarring it can be and physically scarring it can be.
Sure.
So I approach every acne patient differently, individually. And it really depends on what most of the time somebody's coming to see me, they've already tried a lot of things over the counter.
Definitely.
Right? So, they may have already tried Clearasil, which is benzoyl peroxide, or salicylic acid. And they may have tried Proactive, something like that, exactly. By the time they're coming to see me, it's because they've tried and failed those things. So, first thing I'm going to ask is about compliance. How well did they how often did they use those treatments? Were they willing to wash their face twice a day? Are they washing their makeup off at night, which is so important to do? You need to get all that dirt and oils and makeup products off of your skin every night to allow your skin to breathe at night. So, I'll take an inventory, a history, to get a feel for what they've tried before they come to see me and sort of their willingness to participate. So I can give them a game plan. And that game plan typically involves benzoyl peroxide, which, again, they may have already tried. It would involve a retinoid or a retin-A, something like that is like your retin-A or tretinoin, which decreases the sebaceous gland activity on the skin. It also has anti-aging benefits, which we can talk about later. But helping to decrease oil production, the acne bacteria likes to use oil as a source of a food. So decreasing the food source will decrease acne breakouts. Benzoyl peroxide also decreases bacterial load on the skin, as well as topical antibiotics or oral antibiotics. So typically I'll start with the topical antibiotics, and if those don't work or the patient is just not remembering to use them, to get them on the skin. Nothing works if it doesn't get on your skin or in your mouth. So trying to feel out patients to figure out what's going to be the best treatment for them is really important. So I may choose a topical antibiotic. I may choose an oral antibiotic. Oral antibiotics like minocycline, doxycycline, those work very well for acne, but they're not without side effects. So again, I like to start with the topical versions of those things first, if at all possible. Side effects for antibiotics and a lot of acne medications include sun sensitivity. So also getting a feel for their willingness to use or not use sunscreen every day is really important. And Janet will talk a lot about that together as well. So, you know, again, gauging my patients, and especially when I'm dealing with teenagers, you know, trying to gauge their willingness to be involved in their treatment regimen is so important.
Very.
Now, if I've had patients that have tried all of those things, and either they don't tolerate them because they're too irritating on the skin, the topical treatments, or they're not willing to use them on a regular basis, and their acne is severe, then I may consider Accutane. The other person I may consider Accutane for is the patient who may have acne not just on their face, but on their back or their chest, harder to reach areas where you can't get the topical treatments on effectively. For those patients, I will usually first start with an oral antibiotic. But again, if they're scarring and their acne is severe, then sometimes we do need to go to Accutane, which is an oral retinoid, oral form of vitamin A, essentially, that is much like Retin-A internally. So that is very effective, but it has systemic side effects because it's working systemically. So things like beyond just sun sensitivity, but it can be teratogenic, meaning it can cause birth defects in women of childbearing age. So that is something that we have to monitor patients for, counsel patients, making sure they're on adequate birth control and are willing to consistently use birth control. There is a system called the iPledge system that patients and myself, we need to go on and register that we're using Accutane, and there's an attestation form that patients need to agree to comply with those treatment protocols. Not giving blood is also on that protocol, and getting regular liver function tests, because Accutane is processed through the liver, so we want to make sure that your liver is functioning optimally before treatment and at completion of treatment. So treatment with Accutane usually lasts about 4 to 6 months. And again, it's very effective. Very few patients need to repeat a round of Accutane, but some do. And sometimes then we'll when we stop the Accutane, get them back on topical regimens. Yeah. But so, you know, that's what I'm typically doing in the medical setting, with some caveats. You know, sometimes I'll put female patients on birth control if I'm feeling that there's a hormonal element to their acne. Spironolactone is another pill that I use quite frequently for hormonal acne in females. It works somewhat similarly to birth control. It is not a birth control agent, however, and so it doesn't give you any protection against pregnancy, but it does decrease the effect of testosterone on the skin, which is often the culprit in why women are breaking out on hormonal cycles. And then there are some other prescription agents that can help for the skin lightening. So because with acne, as you know, when they heal, they can often leave a red or a brown spot. That's called post-inflammatory hyperpigmentation. And there are medications for that, both by prescription and not prescription. So we'll talk about those as well. So, okay, now for the fun part. So that was a lot of information. But I think what's really interesting is are the options that we have that don't involve medication,
right?
That may involve use a home care regimen. I think no matter what you're doing with acne, you have to be involved, right, to have success.
Absolutely.
So you've laid out some really great options for topical treatments for acne, and you've got some options also here laid out for us with regards to treatments that we can do in the office too.
Absolutely. Where do you want me to begin?
I think we should start with what you do at home.
Okay. Yeah, I think that's a good idea.
I feel like everyone has to do that at home, right? No matter whether it's a prescription product or whether it's physician dispensed type product.
Right.
I think it's really important that people understand that there's homework.
Yeah, definitely. Well, and it's a partnership. So I think it's really important also to understand what types of products to use. You know, acne, we know, is an inflammatory condition. And everybody's first response is, I have to get rid of this oil, therefore I'm going to dry it out. And That's something that you don't want to do, because we want the skin's barrier to function optimally so the body can do what it needs to do. Let that oil, come out of those oil glands, right? Up and out of the body. So how do we do that? Well, we want to use gentle products, not trying products, but gentle products. And I love this oxygenating wash from Skin Better Science. It has salicylic acid in it, which is great for softening the sebum. That's the gunk in the pores, the oil, if you will, so that it can just flow out instead of getting trapped in there. The other thing that happens is we tend to get a buildup of dead skin on the surface. So if you've got oil that's trying to come out of the glands or the pores and there's dead skin over the surface, now you just have everything kind of clogged up in there. And so something that's very effective with that is this Alpha-Ret Overnight Serum. It also has some lactic acid. It has salicylic acid in it. It's considered a retinol. It's not retin-A, which means it's a lot more tolerable and it's easy for patients to stay compliant. And we have it in a serum, but we also have it in an overnight cream, which is great for more mature adults that are experiencing breakouts.
Or that aren't, right? Because there's anti-aging benefits to the retinol
as well. Yeah, definitely. And the salicylic acid, the lactic acid, that's going to help control the oil, regulate the oil production. And it's also going to help with that surface dead skin, helping keeping that moved off and exfoliated without making you look red, rashy, or irritated.
Which we do see with retin-A quite a bit.
Definitely.
And that's one of the number one reasons why people stop using it and become non-compliant, because it irritates their skin too much. And sometimes in those patients, I may opt for Differin or sort of a lighter retinoid that you can get over the counter. Differin also has a stronger version that is called Epiduo that is by prescription. But even those can be too irritating. And so I find this product here, this clearing serum, to be fantastic, especially for younger patients whose skin is a little more sensitive.
Yeah, definitely. I've had patients tell me it's like magic. They can't believe how quickly it started to clear up their blemishes. The other thing that works really well is it's a home care treatment, if you will. So you don't even have to go into a medical spa to get this type of a treatment. It's an Alpha-Ret peel pad, similar ingredients that we have in here, but you just use it at night. It's in an individually wrapped packet. Wash your face to remove the dirt and grime. Open this peel pad. It's already pre-moistened. Wipe it over the skin. That's it. Throw it away. You go to bed. It has a rough side and a little bit of a softer side. So even if you have acne on your arms, shoulders, chest, back, you can reach those hard to get areas.
It's also nice for the condition called keratosis pilaris, which are those little bumps that people get on their skin sometimes. That's a great exfoliating treatment for those patients. So yeah, they're these pre-moistened little towelettes that have the peel ingredient on it, and you can just do it at home.
Yeah, super easy. Once or twice a week at night. That's it. Nothing fancy about it. The other thing, you talked a little bit about PIH, or post-inflammatory hyperpigmentation, and that's where we get discoloration on our skin after we've had a breakout. And this product, it's a illuminating lightening serum, helps to lighten those red, brown spots that we get on our skin. So it's important to use something that's going to lighten that too. They will lighten in time. This will help speed up the process with that.
I do think that using a retinoid also helps speed that process up. So the combination of using a skin lightener product with the retinoid, this is going to decrease your future breakouts, help to lighten, and then this is going to lighten even further if you want to get those little red and brown spots gone faster. I think the active ingredient in this it has niacin or niacinamide.
Right.
Oh, it also has tranexamic acid in it, which is great for hyperpigmentation and a bunch of other botanical things. So great product.
And then two more things that would go along in a regimen. You know, a lot of people who have acne are afraid to put any kind of hydration or moisturizer on their skin because they associate it with oil. And it's actually, you know, hydration is different. When your skin is hydrated, it can function optimally, function the way it's supposed to. Mm-hmm. And so I love this hydration boosting cream.
Yep.
It's a combination of a serum and a light moisturizer that is great for anybody who has oily skin or breakout prone skin, just to keep that skin real nice and hydrated.
And you know what, the other one that I like is the hyaluronic acid serums, just the plain serums. So if you're just a little dry and you just want that little boost of hydration, those hyaluronic acid serums, and we've got a few of them in the office.
Oh yeah,
as well.
Elastin makes a great hydration serum.
Yep.
And then last, and this is so important, whether someone's on Accutane, whether they're taking oral antibiotics, using a topical antibiotic, even when you use any of these retinol type products, you want to protect your skin from the sun, right? You should protect it anyway, but you're going to be more sensitive because of these products. So we have Elastin Hydra Tint. It's a mineral-based sunscreen that has a tint that adjusts to everybody's skin tone. So even though Dr. Weiss and I have different skin coloring, we both use the same product, and it just matches in with our natural skin tone. So for lots of times, you know, young ladies that are concerned about, you know, their appearance, they're feeling a little insecure, this helps even it out just enough without it looking like heavy cakey makeup. And heavy caked up makeup isn't good for your skin anyway. Right. It just clogs the pores and exacerbates the situation. And another one that I really like is for those gals that like to use more like a makeup. This is a compact. It's by Skin Better Science. It's called Tone Smart. It also adjusts to the color of your skin. So unless someone's super, super fair, they can use this and it'll adjust. And it comes in a little cream compact with an antimicrobial sponge that you just move the product around over your face. It gives you nice coverage without looking cakey or heavy. It feels so lightweight, and yet you're getting the protection of an SPF 68.
Yep, I think that's great. I think our goal is to get your skin clear so you don't feel like you need to use so much makeup. Mm-hmm. But I mean, going back to the point of really covering is part of why we recommend these, but really we're recommending it to protect your skin from sun damage. And again, if you're on any real acne regimen, you're more sensitive to the sun. Especially, this is a good lead in, especially if you're going to be doing in-office treatments,
right?
In combination with your topicals. So Jenny, you've laid out a few different options here, and I think we should probably start with hydrofacial.
Okay.
So tell me, so hydrofacial is all of these things are available at Paradise Med Spa and Wellness for those who are looking, but they're available elsewhere too. So not to say we're the only place in town, but but obviously we're the best.
Yes.
So tell us what the hydrofacial is and what it does.
So the hydrofacial is not I'll tell you what it's not. First of all, it's not a fluffy facial. It's done by a trained licensed esthetician, and it's a mechanical exfoliation. In other words, there's a device that Christine, our esthetician, uses to help cleanse the skin, infuse serums into the skin, to clean out your pores, to exfoliate dead skin off the surface. So there's several steps to the hydrofacial. Similar to a regular facial, but you're getting all of these benefits of a mild exfoliation. And then it uses, vortex technology to actually clean out those pores in those areas where the T-zone, where we tend to have those larger pores, things tend to get clogged and stuck, making your pores look big.
It's like a light chemical peel as well.
Yeah, without the peeling,
right?
Without the peeling, without the redness, without the irritation. So I think that's a great place to start.
I agree, especially for a younger patient, someone who's never really done anything. Even for someone who is older patient, if you haven't been doing in-office treatments, then starting with that, I think of it like as detox, clearing things out, and then you'll respond better to any of the other treatments that we're going to talk about.
Yeah, so absolutely.
If you felt like you needed a stronger chemical peel, because chemical peels work also very well for acne, we've got the VI peel.
Love it.
So tell us about that. I know you love that.
Yeah. So the VI peel is a TCA peel, and it is applied in the office. It has phenol in it, so you don't get that stinging that you normally get with a peel.
Painless,
so it's a painless peel, and it's simply applied in the office. You go home with it on. You may look a little, yellowish, right? But
which is the product? What's the active ingredient in it? Do you know that makes you look yellow? Is it the red?
I'm not sure.
Yeah, it does make you look yellow. You look a little jaundiced when you
leave,
but
when you leave.
You wash it off.
But nothing scary. I mean, you could go to the grocery store or whatever in it. I wouldn't go playing sports or anything after having a chemical peel applied. But you leave it on for 4 hours. Wash it off. There are some little towelettes that have retinol on them, pre-moistened towelettes that you're given instructions on how to apply in a very simple to follow little tiny fold out pamphlet. You apply that. There's a cream that comes with it that helps to keep inflammation down. It calms the skin down. It hydrates the skin. It soothes the skin. And then, of course, there's a sunscreen that comes in the little kit. So the wash, the moisturizer with the hydrocortisone in it, and then also the sunscreen are all included with your peel. You don't have to go buy anything to go with it. And what that peel does is it penetrates down deeply into the skin and starts working on oil, on discoloration. It helps to exfoliate the skin surface. And you actually can shed skin. Most people do, unless they're super, super oily. They may not shed as much, but you'll shed skin kind of between days 3 and 5 there. So there is some visible peeling with this.
But it's also calming.
Yeah.
It really does a good job of calming the skin and calming those acne lesions.
Within a week, your skin looks awesome.
Yeah.
It looks bright. It looks healthy. It looks hydrated. It's just vibrant.
That's a great anti-aging and anti-acne type treatment.
Yeah.
We'll get to cost on these later, but let's move on to Morpheus 8. Morpheus 8 is a radiofrequency microneedling treatment. And so tell us about this one.
So Morpheus 8 does not use laser energy. It uses radiofrequency energy to go down deep into the skin. And anytime you have heat like that, you're going to help with acne because of the heating mechanism.
The heating mechanism it does. It helps to kill acne bacteria. But what I think is great about the Morpheus 8 is its ability to help for acne scarring too. So it not only decreases active acne because of the way the radiofrequency energy interacts with the acne bacteria, but also helps for texture on the skin and
scar remodeling, right? Because
great option for that.
Stimulates collagen. So it also happens to be a great anti-ager, right? Yes. So this is not just for the young adult with acne. This is also for anybody that's doesn't have acne and is concerned about
skin
aging,
laxity or aging or texture.
Yeah.
Okay.
Yeah, but I love what it does for acne scars.
I do too. I actually think that's probably the best treatment that we have, other than like CO2 laser resurfacing.
Right. Yeah.
And then we've got NeoClear, which is a laser called the Aerolase laser. And that is like a laser facial.
Yeah, it's a 1064 nanometer laser. It's great for killing that bacteria that's causing acne on the surface. And it's, I kind of like to call it like lunchtime laser.
Yeah.
Because someone could have it done on their lunchtime and then just go right back into their life. A young adult could have it done at the end of their school day and then just go meet up with friends to study or whatever.
Downtime.
Nobody's going to say, what did you do?
It doesn't hurt.
Yeah.
So, and I think that's important, especially when we're treating younger patients. I think things like hydrofacial, the VI peel, although even younger patients are more sensitive to the peeling because they don't want their friends to see them peeling. But hydrofacial, NeoClear, great options for younger patients. I am actually in the process of treating my son who's 14 years old with that treatment.
Yeah.
And he's willing to do it. He doesn't complain about it, which is fantastic.
Yeah.
And then we followed that with the LED light.
Right.
So LED lights are like a bank of lights, and they come in different wavelengths, blue and colors, right? So the the color is based on the wavelength that's being emitted. So there's a blue light, which kills acne bacteria.
Yep.
Red light calms inflammation in the skin. So those two work really nicely in combination with one another. And again, it's painless, it's touchless. They just put their goggles on and sit under the light for 20 minutes. And it works really well and pairs nicely with any of these other treatments. They do make masks and things, those LED masks that people can use at home. Omni Lux is the professional version that we have here in the practice. They actually do make a home mask that I think works well. It's not as strong. And again, it's reliant on the patient to actually do their homework and be doing those things at home. So you're going to spend $200 to $400 on one of those masks. Make sure you're actually using it to get your money's worth.
Yeah, and that it doesn't end up in the closet or under the bathroom
collecting
sink.
dust somewhere. So nothing works if you don't use it.
Yeah.
Like I said before. Okay, and then lastly, AviClear. So AviClear is new.
Yeah.
So tell us about AviClear.
So AviClear is the first laser of its kind that actually targets sebum production, oil production. So it's helping to down-regulate that oil production, which is the cause of acne. And it's done over a series of 3 treatments, 1 a month for 3 months. And then it takes time for those oil glands to kind of down-regulate. We're not damaging them. We're not eliminating oil production because we do need oil production. It's just that anyone experiencing acne has too much oil production. So we're just trying to tone that down.
And decrease, again, the food for the bacteria. So this treatment is more of, I hate to use the word cure, but that's the goal for that treatment, is to really produce long-lasting results after you've completed the series. But it does take time. And so I think for you to see your final result with that. So I think combining it with things like the NeoClear, the laser facial we talked about, maybe combining that with hydrofacial or VI peels in the interim while you're waiting to see your final result with AviClear is really important. So just being patient, which people with acne, like I am one of those people that if I have a pimple on my face, I wanted it gone yesterday. And so it is so hard to be patient. But any acne treatment, unfortunately, can cause a flare, like a little bit of a flare after the treatment as your skin is kind of purging. So you have to kind of be willing to go through a little bit of a flare, whether it's a new prescription product, whether it's a new topical, over-the-counter topical product, or an in-office treatment. You should expect the potential for a little bit of a flare, and that you may need multiple treatments. It's a chronic condition. It's not something that we can cure overnight, even with our most curative treatments, right? So like Accutane or AviClear, it does take some time. So I think patience is key, and just, we really try to set the appropriate expectations.
Yeah, definitely. And, a lot of parents that will contact me for their young adult, or even, I've got 30-year-olds, I've got, 50-year-olds that are, in that perimenopausal range, and they're saying, my gosh, I'm like a teenager again. People will contact me about this because they don't want to go on Accutane. They don't want to be taking a pill. They don't want it to be affecting their entire system. And that's the nice thing about AviClear is that, for example, if the acne's on the face, we're treating the face. The rest of the body is not affected by taking something like Accutane. You also don't have the lab work. You don't have to worry about the liver. You don't have to worry about putting a young gal on birth control, even if she's not sexually active, right? That's still a requirement, on that iPledge agreement, right? That's part of it. So I'm finding AviClear is a much preferred solution by parents and young adults. The young adults don't want to be popping pills, and the parents oftentimes, you mentioned that it's genetic, and these parents feel their kids' pain, and they don't want them to go through what they went through, so they're anxious to jump on this, and we're seeing some really nice results.
So cost-wise and frequency, right? So a lot of these treatments, like we said, it's acne being sort of a chronic condition. You do need multiple sessions. I would suggest to most patients, like the VI peel, again, is like a 3 treatment series, but the other treatments are something that maybe you would want to come in once a month, once every other month. You really need to keep maintaining and be willing to come in for treatment. So it's not a one and done. And then cost wise, really these treatments range. What would you say?
I'm going to say, you've got, your hydrofacials like in the 175 range. You've got your VI Peel and your Neo Clear that are in your 300 range. Your Morpheus is 1200. You're going to do fewer treatments on that. And that's the one that's great, not only for, some active acne, but more importantly for those acne scars, right? And then your Avi Clear, that runs in the, in like the $3,600 range. And, I pair
but
that's
for the package of 3.
Yeah, that's the package of 3. And that also includes some LED treatments, the Omnilux light treatments.
Especially, it's not that different per treatment than the Morpheus.
Right.
Honest. So but we do package it in 3 because we know that all patients need a minimum of 3 treatments.
Right.
So it is an investment. And these, unfortunately, are not covered by insurance. Even the LED light, I have found it is not something that insurance will often cover. LED light is inexpensive. It can range anywhere. If you're adding it to a treatment, it could be $40 or something like that.
Yeah, $40 to $80 in total.
Yeah. So, but it is an investment. If you have an HSA program that is willing to, pay for treatments like this, then you can use your HSA cards.
Financing.
And there's patient financing.
Care Credit, Cherry.
Yep. So we do offer financing programs. And I just think, the best approach is a combined approach is doing your homework, like we said, taking your medications and pairing that with in-office treatments. I think that's going to get you fastest way to get clear, really. So hopefully that was interesting for anyone who's out there
right?
suffering, or if you know someone who's suffering from acne, don't hesitate to give us a call at Norterra Family Medicine or at Paradise Med Spa and Wellness. The number for Paradise Med Spa and Wellness is
62. Oh, I was going to give my cell phone.
Don't give your
602 602-266-8144.
Okay, and if you're a patient at Norterra Family Medicine or want to become a patient at Norterra Family Medicine, our phone number is 623-565-5060. All right, thanks for joining us.
Thank you.